And if it is injected within 3 hours of the onset of the stroke symptoms, it's a real miracle drug because it can break up the clot and allow the blood to continue flowing. In my years of practice at our firm, I've had the opportunity to represent several people who have suffered from a stroke and the debilitating effects of a stroke. Strokes are typically, there are two kinds. There's an ischemic stroke and a hemorrhagic stroke. A little over 85% of strokes are ischemic strokes. And what that means is that there is something that breaks off. Typically plaque will break off and it'll get blocked either in large vessels going up to your brain, so in your carotid arteries, or in the smaller vessels inside your brain. And what happens is that when that plaque breaks off, it blocks the blood flow, and so blood cannot get around the artery. And the longer that happens, the longer the brain tissue that artery supplies blood to is without oxygen and the blood that it craves, the tissue dies. Fortunately, there are treatments for ischemic strokes. There are not emergent treatments as much for hemorrhagic strokes. Hemorrhagic strokes are where there's a bleed in the brain or a hemorrhage in the brain. Those are much more difficult to treat on an emergent basis, but the vast majority, over 85%, are ischemic. And there's something called TPA, and you may have heard of it. It's a clot-busting medication. And what that clot buster does is it's injected through an IV, and if it is injected within 3 hours of the onset of the stroke symptoms, it's a real miracle drug because it can break up the clot and allow the blood to continue flowing through those arteries. And the brain tissue typically then doesn't have permanent damage. If it's over 3 hours, then the brain tissue can be permanently damaged, and TPA is not to be ever given more than 4.5 hours after the onset of symptoms. Unfortunately, some of the cases we see are situations where a patient gets to an emergency room with symptoms of a stroke. And symptoms of a stroke are very commonly known. It's typically one-sided type symptoms. So an inability to use one side of the body. It also can be accompanied with facial drooping, dizziness, some confusion, but it's the one-sided nature of the symptoms that are the hallmark of a stroke. When those symptoms come on, it is essential that a patient get to the hospital as quickly as possible to get that miracle drug, TPA, to break up the clot and prevent permanent brain damage. Over the years, we've been able to consult with some of the top experts in the world on stroke and stroke prevention. And some of those experts have testified for us in some of our cases where we've had multi-million-dollar results for patients who unfortunately did not receive TPA in a timely manner when they got to an emergency room after the acute onset or the acute start of a stroke.